Welcome back to the Home Health Care Today show. It is February, and February is American Heart Month. And what is our goal this week? We want to protect the most vital organ. According to the CDC, heart disease is the leading cause of death in the United States. Every 34 seconds, someone dies from a heart-related ailment, a disease, or cardiac arrest. Today, we have experts who are here to help us uncover some of those hidden gems behind healthy hearts. So we have Sara Hegarty. Sara is the executive director of Southeast Michigan's branch of the American Heart Association. Sara joined the American Heart Association of Southeast Michigan in June of 2023 after leading the Toledo market to 5 consecutive years of growth, including 4 years of record-setting fundraising. She was named Toledo's 20 Under 40, named to that list in 2018. Previously executive director of the March of Dimes in Northwest Ohio. She's a mother of 3, passionate about spreading awareness at the starting point for community health transformation. Also, we have Dr. Phillip Levy with us today. Dr. Phillip Levy is the endowed S. Thomas Professor at Wayne State, Professor of Emergency Medicine. He's also the Associate Vice President for Translational Science, and he's the director of the Wayne Health Mobile Unit and a fellow of the American Heart Association. Dr. Levy and Sara Hegarty, welcome to the Home Health Care Today show.
Thank you for having us.
Oh man, so this is a topic that is close to home for just about everyone out there in our listening and viewing area has known of someone that was affected by heart disease, if you indeed are not being impacted or affected yourself at the moment. So let's kind of talk about it. Sara, as you've dedicated your life to organizations like American Heart Association and the March of Dimes, what does this work mean to you personally?
You know, I always joke that in my 9 lives, my previous career, I started serving on boards of directors. And I realized how many people are affected by different things. And then it affected my own family. And you really want to take action. You want to do something. When something bad happens, you want to make sense out of it. And so that's really how I got involved, is I wanted to do more. I wanted to see more change. And the only way to be part of that is to be part of the solution. And, now my work is just driven by all the survivors we meet and work with day in and day out. Their stories are the ones that we need to be screaming from the mountaintops.
Absolutely, Sara, for sure. And we appreciate the passion and your focus on patients and families in their lives, right? Dr. Levy, going to you, your years of experience as an emergency room physician, you saw a lot. And you saw individuals that did come in with chest pain and complaining of issues with their heart. But you realized that there was a problem behind the problem. You want to shine some light on that for us?
Yeah, absolutely. So first, I just want to say how great it's to be up here with you, Sara. Sara and I have worked together for a number of years at the American Heart Association. And the American Heart Association is really a leading organization in our country for teaching people about heart disease, what they need to be aware of, but also supporting infrastructure and access to resources, and especially funding for grant-related work. So I'm very proud of my time that I've served on the AHA, and I'm very happy to have Sara here in our market helping to lead our community forward. So back to your initial question, I've worked at Detroit Receiving Hospital for 20 plus years as an ER doc. I trained at Bellevue Hospital in New York City. And in both of those circumstances and other places I've worked, I've seen way too many people far too young for the pathology they have coming in. So people in their 50s and 60s presenting with heart attacks, acute heart failure. I know that's near and dear to you with your father, as we were talking about as we were leading into this segment.
Yes.
And it's, I wouldn't say easy, but it sort of makes sense to create a circumstance to do the best care you can for the acute problem before you. But if you keep doing that over and over again, you realize after a while you're just kind of throwing Band-Aids on the problem, not really getting at the root cause.
Yes.
And one of the things that I noticed when I moved here from New York City more than 20 years ago was that we had a tremendous number, large numbers of young black men and women presenting to the emergency department, not necessarily with heart disease, but with high blood pressure. And one thing we know that in all of medicine is that high blood pressure is the leading cause, the leading what we term population attributable risk for developing heart disease, not only in our country, in the world.
Yes.
And so it stands to reason that we should really be focusing on identifying people with high blood pressure,
True.
getting to them early before they develop complications, and not just creating infrastructure like emergency departments to help acute problems, but
Yes.
recognizing that while I'm in the ER and someone comes with an ankle sprain, but their blood pressure is markedly elevated, the ankle sprain is going to heal, but the blood pressure is going to stay with them forever unless they do something about it.
Absolutely, absolutely, Dr. Levy, and thanks for that, because we understand in serving clients through American Advantage Home Care as well as Eye Care for Detroit, doing business as Eye Care for Michigan, when we take blood pressure for some of our clients, some of it's relatively high, the 180 over 120 or 130, and we ask folks, hey, did you take your meds today? Some say yes, some say no, but we try to encourage them to take those meds, right? And in the event that it stays high, we're sending a notice to the primary care physician and telling folks take the meds. We'll circle back.
But I think, Clem, what's really important is you're not waiting for the primary care physician to be the one to identify the high blood pressure. And as a proud member of your board for Eye Care for Detroit and somebody who I work closely with on a regular basis around these approaches, that idea of being out in the community, that idea of meeting people where they're at, and I know this is near and dear to you as well, Sarah,
Absolutely.
the idea that we can measure blood pressure anywhere.
Absolutely.
And it doesn't need to be a special trip to the
That's
doctor.
right.
It doesn't need to be something that you go out of your way to do. It should just be part of your daily life.
You got it, Dr. Levy. Sarah, back to you. You represent the Southeast Michigan area here, so you could throw in Oakland, Macomb. We got viewers and listeners everywhere. What's the state of the heart in our region?
We have two major focus areas right now. One is CPR readiness, which I'll talk about later, but also high blood pressure.
Yes.
40% of our population is suffering from high blood pressure, whether they know it or not. And one of the actions that our team is taking is really teaching people to take their own blood pressure.
Yes.
And so we are going into faith-based communities. We are in community organizations. We are in corner stores, and we are putting blood pressure hubs where we want people to go and sit down, take their own blood pressure, so they know. Because you can have high blood pressure and be walking around symptom-free and you don't know. And then giving information of if it is high, where do you go? What do you do next? And what if you don't have insurance? Where do you go? And we have those answers and we have those solutions, and we want to make sure it gets into everyone's hands.
Wonderful, Sarah. Wonderful. Dr. Levy, we're having a real good game of ping pong here, right? Beyond the hospital, right? Sarah and the American Heart Association goes beyond the hospital, but I know you do too with Wayne Health Mobile Unit, and we do when our vans pull up at the same time. There's the Wayne Health Mobile Unit. There's the Eye Care for Detroit Vision vans. But talk to me, Dr. Levy, outside the hospital.
Yeah, absolutely. So having spent a lot of time in the hospital, you realize that showing up there with a problem is kind of a failure of the prevention network in our country, right?
Yes.
And this idea that we learned through the pandemic that, you can do it on your own. You can go get your lab test. You can go figure out what to do with the results.
Yes.
Speaks to empowerment of individuals. And as Sarah said, right, you want people to be able to measure their own blood pressure. People need to know their numbers, and they need to take control of this information.
Yes.
It's not proprietary to your doctor. It's not something that's special and hard to do. Anyone can measure a blood pressure.
Yes.
Anybody can measure someone else's blood pressure. And so it's really critical to have ubiquitous availability of devices to measure blood pressure. There's many, many of them out there, whether it's a kiosk at CVS or in a social service center or whatever it might be, or it's you measuring blood pressure when you're looking at someone's eyes.
Yes.
What we did during the pandemic was realize first and foremost that the emergency care infrastructure of our state, of our nation, collapsed under the pressure of the pandemic.
Yes.
In order to provide services to people so that they weren't showing up with severe COVID too late, we started the first program amongst the first in the nation to have people drive through and get COVID testing done. We created this for first responders and healthcare workers and the like. At one point, 50% of all police officers in the city of Detroit were on quarantine because they were exposed to COVID. And they didn't know if they had it or not, so we needed to be able to test people. But what we realized through that engagement is that if people drive up and we test them, that's great, but we could actually take care out into the community. We are, after all, the Motor City.
Absolutely.
So we reached out to the Ford Motor Company, and they were delighted to help us out by providing Ford Transit vans that we could start to deploy to different areas of the community to go do COVID testing. And then after doing that, we realized that people were starting to speak with their feet and in their vehicles, right?
Absolutely.
And they were showing up to non-traditional healthcare settings. And we realized that we could move beyond just COVID testing, ultimately COVID vaccination, towards a vision of what we call portable population health. And what is population health? That's not one doctor, one patient. It's how do we make all ships rise in the entire population? Well, you got to get out there, you got to meet people where they're at, you have to engage them, you have to give them information that they're going to find valuable and actionable.
Absolutely wonderful stuff. And walking the walk, talking the talk every single day. Last month, January, was Social Determinants of Health Month, and of course, we're mitigating, from that description, mitigating those social determinants of health. Prior to our commercial here, let's talk a little bit about stress and stress management. So, wearing my late dad's suit here, who passed away in 2007 of congestive heart failure, right? Ran a body shop on Livernois between Joy Road and Tireman for many, many years, lived to be 79 and a half. How can we begin collectively, Sara and Dr. Levy, how can we begin helping individuals with stress management, and then changing the expectation of, hey, I don't just have to struggle and suffer, because I have, a load, a financial load, or because I'm in an urban area. How can we begin to mitigate and change that mindset?
I'll jump in. Actually,
Yeah.
why don't you go, Sara?
Well, I'm glad you're talking about stress, because stress, specifically workplace stress, is just as harmful to your cardiovascular health as secondhand smoke. And we're not talking about it. And so it's really finding that support. Where is that support? So number one, I say always listen to doctors first and foremost.
That's right. Medical doctors. I'm a
Absolutely.
PhD. I'm a PhD. Listen to this guy, for sure.
And the next is remembering we have our Life Essential 8, and they are 8 healthy habits that anybody can utilize. And all of that is on our heart.org. Because I could go through it all, but then we'd be here for 5 days.
That's
so,
right.
Which wouldn't be a bad thing.
No,
since we
it
enjoy
wouldn't
each
be.
other's company
Yes.
here.
That's right.
But if I could, add to that, I think the most important thing about stress is to recognize when it's present and to be mindful about what you can do to mitigate it or reduce it. To continue with that idea. And the thought at the workplace is: do I have to get upset about this? Is it worth it? Do I need to feel this inside, or can I just step away from myself? Take a couple of minutes to deep breathe, have a glass of water or whatever it might be, and come back and reflect on the circumstance and perhaps handle it differently so that I'm not getting upset, the person I'm working with isn't getting upset. But like you said, it goes beyond the workplace. There's many different stressors. How many of us drive in the car and are almost ready to get angry when someone cuts us off? So I personally have always taken the tact, or at least more recently, of being mindful when I feel myself getting upset, just tamp it down a little bit, decrease the pressure, so to say, both literally and figuratively, of the circumstance, and say, what can I do differently? How can I handle this without getting upset? And we do that with our children. You have 3, I have 2.
Absolutely.
And I just got a new puppy, and I want to
the
get stressed
puppy.
all the time when that guy's leaving his business on the carpet. But you can't.
Yeah.
But you can't do it, right? Because at the end, you're only hurting yourself when you react that way. And so the most important thing, I think, from stress is to be aware when it's present and do what you can do to reduce it and be mindful.
Absolutely, Doc. Hey, that's a perfect segue for a commercial. We're going to go pay some bills here, and we'll be right back.
When a heart stops, the clock starts. You are the first responder until help arrives. In that moment, 4 minutes equals brain damage. 6 minutes equals too late. In an emergency, the first responder is you. We need you. And you. And you. Will you be ready? Learn CPR. Visit heart.org/nation.
Welcome back, and it's still American Heart Month, right? And our guests for this segment are still Sara Hegarty of American Heart Association Southeast Michigan branch and Dr. Phillip Levy. So we're diving and digging deep here. A shout out to our show sponsor, Meridian Health Plan in Michigan. Meridian is Michigan's largest Medicaid HMO, and Meridian sponsors our show as well as our I Care for Detroit mobile unit. So major shout out there to Meridian for all that you do. Care above all else. Phil, we were talking about social determinants of health. We were talking about stress in our first half of today's episode. The data, right? So I was mentioning Dad and struggling with, high blood pressure and ultimately passing away from CHF. But we were in the 48227. That was our zip code. And then Dad's shop on Livernois was like 48204, 48207. There are some things, Phil, that you know about zip codes and some data outcomes. So how about it?
Share appreciate that. Before I get going, just also want to thank Meridian, who supports us as well with our women's mobile health unit. So Meridian's a great partner to do great work in the community. But you're right. So it's so important to know information about the neighborhood where you live. AHA has promoted this. Others have said this. Sometimes your zip code is more important than your genetic code, right? Mm-hmm. We have areas all across the city of Detroit where people are dying 5 to 15 years younger than the state average. Just along the border of Grosse Pointe to Detroit, some folks are living to 80 and some folks are dying at 60, and that's a shame. Absolutely. In the wealthiest nation in the world, right? Absolutely. But what we can do is better understand the communities that they come from so that we can apply proactive outreach, proactive response, proactive work to mitigate those risks, right? Absolutely. And so we created a program at Wayne State called Phoenix, the Population Health Outcome Information Exchange, which allows us to pull in health data, social determinant data, environmental data, so we can know what risk factors specifically contribute in what geographic locations to the health problems that we're seeing. And instead of just focusing on the end result or the end manifestation like heart disease or, in your dad's case, heart failure, let's get upstream. Let's see what's contributing to the stress in the community, as we were talking about. What's contributing to perhaps environmental exposure to air pollution, noise pollution, whatever it might be. Maybe there's poor transportation in that area and we'd like somebody to be able to go to a doctor, but they can't do that. So we can use that information to target outreach and know what to do before we even get into those areas. And that's the basis of the mobile program, as we've talked about for I Care for Detroit and for the Wayne Mobile Health Unit. It's really important to be purposeful where you're deploying. It's really important to be able to reach people with things that they are going to be receptive to.
Absolutely.
Data is everything.
It really is, Sarah.
We use Phoenix too.
Hey,
my team uses it when we are looking about what we're doing in the community. It is so important.
Absolutely. And to all the viewers, anyone can go to the website, search up Phoenix at Wayne State, and the tools we have, the data information is freely available to everybody.
Yep. And it's trusted.
Yes.
It is a trusted source.
Thank you.
And that is such a helpful resource. And, shout out to our new mayor, Mary Sheffield, right? Looking at health and wellness, but also looking at the determinants of health, social determinants, and saying, hey, poverty, we can alleviate poverty. We can address homelessness and bring solutions. So I love this work. Sarah, that's the segue to advocacy. Talk to us about how do we advocate for some of these individuals out here that fall into various buckets who may not have a voice or may go to a doctor or in a doctor's office and say, I don't think my doctor's hearing me, or I don't think I'm being understood.
Yeah.
How can we advocate better?
Yeah, you really have to trust yourself to speak up. Advocacy, I think about advocacy on two levels, right? So you're advocating for yourself at the local level, at the doctor's office, at a variety of places. Parents, we advocate for our kids at school. And then our organization, we're advocating at the city and statewide, as well as the national level, for overall well-being in our state. Yeah. So my team has a state advocacy director, and we have worked tirelessly on things like healthy school meals for all. And every cycle, that funding is at risk. And when we think about healthy meals, and when we think about nutrition security and our children and how important that is. It is the fundamentals. I mean, if our kids aren't fed at school, how are they going to learn?
Absolutely. That's it. So there's that connectivity there. Phil, speaking of food and nutrition, blood pressure, we don't want to be, no pun intended, pie in the sky here. Um, not that our show is not about giving medical advice per se, but helping individuals or guiding folks to healthier choices, diet and exercise as related to heart health.
Well, this is top of mind
Yep.
with the recently released inverted pyramid coming out of, Washington, D.C.,
Sure.
and trying to understand and
Yeah.
make sense of what things should we put in our body to
Sure.
stay healthy, right?
Absolutely.
We know that high sodium is an important part, a contributor to both high blood pressure and heart disease itself. We know high-fat diets contribute to early development of atherosclerosis, which leads to blockage of blood vessels that causes heart attacks and strokes. We all have an active role to play in this. And I think between the stress, somewhat social determinants, and in particular diet, we have to own the circumstance. And we can't always afford perhaps the best or most expensive type of meal, but we can certainly eat healthy.
True.
Things like Eastern Market and the things that they do there with double up food bucks availability to get fresh produce.
Yeah.
Those are the types of things that we really want people to understand. We've done
Absolutely.
work through American Heart Association supported research looking at what type of menu could you offer people that they can pick and choose items that they know will be heart healthy. I think a lot of us think we know,
Right.
but we don't always know. I mean,
Exactly.
certainly nobody thinks Doritos are healthy, right?
No,
that
put 'em on
color
blast.
alone
Put
can't
'em
be
on-
good for you,
put 'em
right?
on- and then what it does to your fingertips.
Right.
I know.
You get Cheeto tips.
You can't hide those.
Exactly,
You can't hide those.
exactly. But the point here,
Yep.
right, is
Yep.
that we have opportunities to do things for ourselves.
We do.
We aren't passive,
Nope.
recipients of
True.
badness all the time,
That's
right?
right,
We can
bro.
be active, and I think there are a lot of resources, as you mentioned, what the city's doing to promote this, what the American Heart Association is doing to promote this, but what areas we can go to, like Eastern Market. Doesn't have to be on the weekend. You can go during the week and get fresh produce and those things. Some of the work that we're doing in partnership with them is taking mobile markets into communities where we're doing blood pressure screenings and then offering people access to produce. If they can't afford it, we're willing to pay for it. And I think that's a really important thing.
It is, and our sponsor Meridian and the work it does with the food bank, and then you got Forgotten Harvest and Gleaners. So there's a lot of resources that individuals might not be aware of. And at American Advantage Home Care, not only do we go in under doctor's orders for skilled nursing, for wound management or medication management, if we need to bring in a bag of groceries, we're doing it. If we need to bring in materials about heart health, we're doing that, Sara. And Dr. Levy, when it comes to Wayne Health, bringing Wayne Health along with us into the communities, that's what we're all about. So let's dive a little deeper and go into homes now, home health, and folks that are homebound that say, hey, all of that sounds good, but I'm in the bed. Or I'm a caregiver. There's a caregiver connection where I'm sandwich generation. Take care of the kids, then I come home to take care of an aging parent. And all that good food you all are talking about, those stores are closed by the time I'm done with all that. So how can we make it better for people in their homes?
Yeah, I think doing the home visit is important, right?
Yep.
Understanding what's in the cabinet or the refrigerator
Sure.
and helping people understand what they can do to maybe do a little bit better.
Yeah.
If they can't go out and purchase stuff, there's a lot of options now of home delivery. There's a lot of ways that we hadn't had 5 years ago
Come on.
to go ahead and order online and get the right stuff. And I think it's just really important for people to understand that even if they're homebound, they're not isolated. They don't have to be, but it's hard to see that when you're sitting there by yourself, right? And so I think, again, getting back to that advocacy piece is so important, but having infrastructure to be able to go out and deliver services, right? That's critical.
Yes, very much so, very much so. Oh, we've covered quite a bit of topics here. So I'll ask you both, what's the hope? What's the great hope for present as well as future, right? There may be some folks that are saying, I don't know about the economy, or I don't know about the future of healthcare in America, or how things will get paid for. We mitigate, we solve problems around this table and on the Home Healthcare Today show. So let's elaborate a bit. What's the hope? Great hope for the future.
I love the word hope. Our mission statement for the American Heart Association is hope and health for everyone, everywhere, which sounds so large and overwhelming, right? But when we break it down, there is hope because there's people out there doing the work and wanting to make differences. And when we come together, changes are ahead. And, thankfully, due to our supporters and our donors, we have over $60 million in research in our state alone about what's next.
Yep.
Things aren't going to look the same in 10 years. And yes, there are a lot of unknowns, and it is a scary time. But to keep that hope, to know that there's organizations working on building out the infrastructure, getting that research and bringing it to the table so it is going from theory to practice, and knowing that it's going to happen. We are going to be changing together.
Yes, that's right, Sara. No doubt about it. And with champions like you that commit so much of your time, your energy, and then your staff, around the region, and then of course, American Heart Association, a national organization, various state chapters, you're walking the walk, talking the talk, and getting it done, and that we appreciate. Dr. Levy, how about you, sir?
Well, first, as one of the recipients of some of this American Heart Association funding, I'm very grateful for what the organization does to advocate and support for this.
Yes.
We have projects, Leap Hypertension is one of them, which is funding research on the mobile outreach to show if we can make a difference. We have funding from the National Institute of Health that supports that.
True.
Our biggest funder is the Michigan Department of Health and Human Services, which has funded the mobile health infrastructure that we oversee for not only Southeast Michigan and Wayne Health, but the entire state.
Yes.
And so my hope is that we have the will to make a difference.
Amen.
We have the will to implement and make change possible.
Yep.
But I also have hope because people are becoming aware that they are able to self-manage their conditions.
Indeed.
People who might be feeling dismayed about some of the things going on in politics in the country right now have to understand that they still have a voice.
Yep.
They still have actions that they can take. And the most important thing they can do is take care of themselves.
Yes, they can.
Know your numbers. It's not okay to be fearful of knowing what your blood pressure is.
True.
Go know your blood pressure so you can do something about it.
Absolutely.
And I think that's the other side of it too. I think through the pandemic, we've learned that we can do this.
Yes, we can.
I can go get a life-threatening diagnosis like COVID and then actually figure out what to do with it. So when we tell you what your blood pressure is and give you a list of things that you can do, pick and choose what you want to do, but do something more than nothing.
Absolutely.
And my hope is that people walk away saying, I can.
Absolutely. And that's what we're here for. At the very least, tune in weekly to the Home Healthcare Today show every Saturday morning, 10 a.m., WNYD TV 20. You could always follow us on YouTube, the Home Healthcare Today show channel on YouTube. So next week on the Home Healthcare Today show, we're going to focus on cardiovascular professionals. So you won't want to miss Dr. Jeffrey Miller of Miller Vein. Stay tuned.
We've got to consider 4 other things that are very interrelated. Arteries are going to carry blood to your extremities, to the organs. Need those.